Mark, thanks. So the damage left from Hurricane Helene is impacting healthcare across our region. As we know, Alan Levine, Ballad CEO, here to explain some of the issues that Ballad is facing in the wake of last week's flooding. Thank you for being here. And I know it's been crazy for everybody. But first, tell us a little bit what's been going well and what are some challenges that Ballad has been facing.
Well, I think first of all, what's going well is that the team has come together and really coordinated well to try to respond to all the different issues that come up. You know, we evacuated patients to Holston Valley Medical Center, and then it wasn't on our bingo card that the water system in Kingsport would go down. So our ability to coordinate quickly, our primary goal is preservation of life, and our team members are so engaged right now. All they want to do is help and take care of other people, and I'm very inspired by them.
That's wonderful. Any challenges besides water and everything else? Anything else going
Probably
on?
the biggest challenge for us is, number one, we want to make sure we take care of our team members,
sure,
so they can help other people. We've had over 80 team members that were impacted by the storm. We've given out over $250,000 of team member assistance to those team members and their families, ranging from $150 all the way up to $10,000 to help them deal with their challenges at home, so that they can come to work and help serve other people. And so the challenge for us is always just to make sure that we've got the staff to be able to take care of the people that trust us with their care.
Staffing and supplies as well. We're hearing about an IV bag shortage. Can you tell us a little bit about that?
Yeah, this is an issue. The Baxter plant in North Carolina got wiped out by the storm, and they provide over 70% of the supply of IV solutions for the whole country. Wow. So we've been notified. We've been put on a 40% allocation. Of course, our advocacy has been they should prioritize those of us that are in the disaster zone, because we don't need one more problem.
Right.
But our physicians throughout Ballad have been working together to come up with some protocols for how to conserve solution. But right now, our folks are trying to anticipate, how much supply do we have on hand, and then what do we need to do to adjust. But yeah, I know that we had a call with the federal government this afternoon, and I know they're working on trying to figure out how to get additional production. And we'll just have to we'll keep you informed on that, but that is going to affect us.
It definitely will. So let's talk about blood shortages. When something like this happens, obviously the need for blood is there, and it's critical. How is our blood supplies right now? Well,
it's good, and I'll tell you what, it's good because those students at ETSU organized on their own a blood drive last week. And they, gosh, I think we had over 670 donors. It was a record.
That's amazing.
And I'm so proud of the students over there and the leadership at ETSU. They partnered with Marsh, which is as part of Ballad, and what a great display of support.
That's true, but blood donations always needed.
Oh, always.
Right.
We certainly need that, and we expect to see a lot of injuries, and so yeah, for sure, we need all that support.
And quickly, what can we expect from Ballad moving forward as everybody just tries to recover from this?
Well, we hope to have Greenville Community Hospital back open this weekend. That's great news.
Yes.
We're starting the evaluation process at Unicoi to figure out, we got to first get a grip on what the facility is going to be like, or
sure,
if it's salvageable. But we are about to open we are converting an office building that we own there into an emergency department, so we can convert from the temporary medical support unit to a full freestanding emergency department to serve that community. So, and then we'll start working with local leaders to figure out how to go forward. But we're stable, we're doing okay, and right now we're just leaning in to try to support the mayors. Mayor Woodby, Mayor Grandy, they've all been, Mayor Morrison in Greenville, they have all been so supportive, and we've just been trying to lean in and support them wherever they need us.
All right, Alan Levine from Ballad, thank you so much for being here and kind of keeping us up to date.
It's good to see you again, Sarah.
We appreciate it. Well, for more information on which hospitals in our region are being impacted by the flooding, you can go to WJHL.com.